Hi everyone, sorry I haven't been on for so long. I've had a pretty hectic week. I've had my school formal, I've had my scavenger hunt, I've signed out of school, and along with all of that I've had blood transfusions and treatment. So today I'm going to be answering the question that many of you are probably asking, and that is, what is Crohn's disease? So Crohn's disease, I'm going to try and do this simply because anyone can go look up Google like what is Crohn's disease, but they probably are like, those websites are really like technical, and I just want to do it in simple terms. So Crohn's disease is a chronic inflammatory disease of the intestines. It is also referred to as an autoimmune disease because the body attacks itself in the intestine. It usually causes ulcerations, which is the inflammation in the intestines, and it can occur anywhere on the digestive system, but primarily it happens in the large intestine and the small intestine. Crohn's disease is closely related to another chronic inflammatory disease of the intestines, and that is ulcerative colitis. They form a group of diseases known as inflammatory bowel diseases, which shouldn't be mixed up with irritable bowel syndrome because they're two totally different things. IBD is a chronic condition, and inflammatory bowel syndrome is not. Yeah, that's what I can just put on it right now. Both Crohn's disease and ulcerative colitis have no known cure, but they can be controlled. I just have had no luck controlling mine. The prevalence and incidence of Crohn's disease and ulcerative colitis has gone up in recent years. There is no known reason why this has happened, it just has. It most commonly begins in the teenage years and young adults who are between 15 and 35 years old. Crohn's disease and ulcerative colitis can be more relevant in people that have relatives with these diseases. This has happened with me because my mum has ulcerative colitis and I have indeterminate Crohn's or colitis. The cause of Crohn's disease is unknown. Some scientists think that it has something to do with a bacteria that caused infection in early years. Some think it has something to do with your genes. Some think it has something to do with the activation of your immune system. So I personally think that it has something to do with your genes because my mum has ulcerative colitis and now I've got a form of IBD. So yeah, that's just my personal thing, but I'm not a scientist or anything. Some of the symptoms of Crohn's disease include abdominal pain, diarrhea, weight loss, loss of appetite, bleeding, fever and night sweats. The complications of Crohn's disease can either affect where it is, like in the digestive tract, or other places that have nothing to do with your digestive system. Intestinal complications include obstruction of the small intestine, abscesses, fistulas, and I don't know if I said that properly, and intestinal bleeding. There can be life-threatening complications of these as well, including rupture of the bowel, and immediate surgery happens then to try and save a patient. Complications that have nothing to do with the intestinal tract include eye complication, which can cause visual difficulties, skin involvement, which includes painful red spots on the legs, and an ulcerating skin condition, generally found around the ankles, but I'm not even going to try and say what the name is because it's too hard. People with Crohn's disease can develop arthritis, usually rheumatoid arthritis, because that is an autoimmune disease as well. Inflammation of the lower back and the spine can cause pain and stiffness in the spine. Inflammation of the liver and the bile ducts. So yeah, in conclusion, I sound like I'm writing an essay. In conclusion, Crohn's disease is a chronic inflammatory disease of the the digestive tract, which is primarily evident in the small intestine and the large intestine. Symptoms and the activity of the disease can come and go during remission and a flare-up. Even though there are many effective medications, there is still no known cure. Surgery can significantly improve the quality of life of the patient with Crohn's disease, but the recurrence of the disease is very high after surgery in patients with Crohn's disease. The disease can have complications both within the intestinal tract and outside the intestinal tract. There are always new treatments being actively evaluated in hope that a cure will soon be found. I think I've touched on everything. If you have any questions about the disease or about me dealing with the disease or anything, leave them down below. I'll make another video answering all your questions, and I promise that I'll do all of them. I'm going to make another video explaining exactly what ulcerative colitis is, and another video explaining the difference between ulcerative colitis and Crohn's disease, and maybe the difference between IBD and irritable bowel syndrome. I hope this has given you a better understanding of Crohn's disease, and yeah, I'll see you soon. I probably won't film for a week because I'm off to school at least this afternoon, so hey, I'll see you all in a week.